we're just getting some final little details kind of wrapped up. If everybody can just
Everyone is
have a little.
muted for now.
Everyone is muted, and
Okay.
it'd be great if everybody could stay muted until the portion of the agenda where we open it up to everybody. Um, I'm just I can't see myself, which is probably a good thing. So I want to welcome everybody that has joined us this morning. Um, we have with us this morning, we have our presenter, Dr. John Yap, who will be talking measurements with us this morning. And also we have one of our other board members, Linda Yang, who is a nurse practitioner out of, oh gosh, I keep forgetting, out of New Westminster. Correct me if I'm wrong, Linda.
Over Richmond.
Um,
Close. It is okay.
Close.
Perfect.
Over
So
the bridge.
she's bringing in some of her insights too, as well. And me, I am Joelle Murray. I am with Oscar BC as the executive director and all around organizer of all things Oscar for BC and beyond. Before we get started, I'm going to do three shameless plugs, as Dr. Yap has has named them. First of all, I'd like everybody that joins us today to please think about and consider joining as a member of Oscar BC. Our work is such as this lounge session and the advocacy work that we do relies on the support of membership. And in order to continue our support of all Oscar users in BC and across Canada, we do really need your support as members as well. So please consider that. If you have questions about membership, please ask me or visit our website. Some exciting news is we are actually celebrating Oscar BC's 10th anniversary this year, and we'll be celebrating at our upcoming AGM and luncheon event on June 13th. Please look for more information about that. We will be celebrating a little Oscar fun during the event, and we're excited to have keynote speaker Dr. Kathleen Ross, who will be speaking on developments of AI in healthcare and on Bill S5, the Connected Care for Canadians Act. And we have another presenter as well, Dr. Tommy Gershman from Doctors of BC, who will be presenting on the current status of e-referrals in British Columbia. So please join us for that. Look for information. Buy your tickets. Ticket sales are open, so do join us for that event and help us celebrate. We also have our next Oscar Lounge on June 27th, so keep an eye out for that. That will be with John Wilson, one of our board members, who is actually from Ontario. And he will be presenting on upgrading your eForm with the eForm generator on June 27th. So look for that as well. So those are my three shameless plugs. I just want to give you a quick overview of what the Oscar Lounge is. It is a little bit different. It's a new format for us. We will have some instructional learning from Dr. Yap and others, but we wanted to keep this mostly peer learning. And so we'll be engaging you for insights, updates, and unfiltered dialogue for the most part. So Dr. Yap will do a short presentation, and then the discussion will open up, hearing from you as users, including some MOAs on your experiences and exploring challenges, your best practices, ideas, and questions about measurements in Oscar. Please keep your mic on mute for the presentation portion and use group chat if you have burning questions. We will be watching for those. Dr. Yap has a disclosure that he'll mention very quickly. And to let you know that we are recording for our Oscar peers who are unable to attend today. It will be posted on our YouTube channel. So if you need a refresher as well, you can revisit that soon after today. We may also use a whiteboard today. Noting best practices, challenges, and ideas is fairly simple. If you're not familiar with it, that's okay. It's all part of the learning together, and we can make a mess of it if we want. So little fun may be coming down the path today. We'd like to wrap this up in about 90 minutes, but we have scheduled for 2 hours. I hope all of you can stay with us for the length of the session. And then we'll release all of you to enjoy the rest of your well-deserved weekend. So at this point, thank you for listening to me. I will turn it over to Dr. Yap to run with the rest of the show.
Thank you so much, Joelle. So yes, indeed, I have a disclosure YouTube video. It's posted on the oscarbc website, so I won't delve into that too much. Hope everyone can hear me all right. This is a throwback to the good old days when Oscar was very different. The world was very different, but like everything, we have to adapt to the times. This is a reflection of that. We have to have a different format to interact with our audience. I think we're still dedicated to help users of Oscar of all stripes. I guess I consider our group more of a lobbyist, I suppose. But over the past many years, we seem to have lost the ability to communicate with some of the big players, but we are still dedicated to helping end users. And to that end, that's why we're here today. Okay, a quick land acknowledgement, if you will. I, live and work in unceded territories. I'm here in New Westminster. We can't change what's happened in the past. All we can do is do better. And that's the main theme, not of what we need to do for our First Nations citizens, but also for Oscar itself. So I'll leave it at that. I want to start with a very quick introduction to Oscar measurements. Simple. Some of that's covered already in the YouTube video, and I'll delve into some more complex areas. And hopefully, as we get into further discussions, I would like this to be interactive. I need your feedback, so I learn as much from you as I hope you can learn from me. That's always been the case. Okay, so I'll start with just the basic description, what a measurement is. And I hope all of you have discovered the measurement area. It's one of the many key areas within Oscar that I think is poorly taught, poorly managed, maybe in unknown areas, maybe uncharted territory for you. And if it is, that has to be rectified. Firstly, it's simply a way of tracking an indicator. In the simplest form, it's a number over time. Vital signs, your weight, your height, blood pressure, and so on and so forth. But it can track other things as well. Status, yes, no things like do you smoke, do you drink? There's full-on text. It's used in multiple areas because the utility is quite vast, but ultimately it is a way of tracking something you feel is important over time. And many of the measurements are built in. Many of them are automated. How it works is a bit of a dark art, a bit of a mystery, but you can make it your own. That is what drew me to Oscar in the first place, how you can customize it. It is both a blessing and a curse, because with too many cooks in the kitchen, you may have a totally different outcome for the same recipe. And I think I can show you some of that today. As much as I can, I'm going to show you screenshots and generic views of live Oscar, hoping not to reveal any personal confidential information. I tried my best to do so. So I'm going to start screen sharing, and hopefully this works. We did a practice session earlier. So let's do this. Screen share. Two. So you'll see me turning my head this way a lot because this is my camera and that's my big screen. Right now, it's just the background. That's that. And hopefully, Now I can't see you, but hopefully you can see a schedule page. This is my version of Oscar, and hopefully you can see that. Yes, Joelle?
Uh, so I'm getting comments from Marlies that she's not seeing anything. Okay, you've zoomed in.
Yeah.
I can try and maybe exit the lounge and come back in. I saw you, Joelle, when you were first speaking, but now I just see empty heads.
There's,
Oh,
I've got my
okay.
whole screen to display, and this is going to be critical here. Let me stop sharing and try again. You can see this is definitely uncharted character. Here's desktop 2 and sharing. All right. Can everybody see a schedule page? It's Saturday. I've got Oscar BC highlighted in red and a couple of test patients. Yes, no, maybe?
I'm just letting people rejoin and see if that
Mm,
works.
yeah.
Okay, Cam is saying he's not seeing anything either.
Is it because I'm not a co-host?
You are a co-host, Dr. Yap.
It worked in the morning.
It worked in a test. So
Okay.
yes.
So bear with us. We will figure this out.
Oh, that looks like it works now.
Oh, what did you do? And thank you.
Can everybody see now?
Can we get a thumbs
Got
up?
it working. Okay, so we
Yes.
clicked something and it seemed to have worked. So yay.
Yeah, okay. So this is our schedule. Everybody's familiar with some variation of this, okay? So I think I'm just gonna jump into Johnny Rotan. This is a pretend patient, and hopefully that's big enough, that's reasonably visible. I was playing with this earlier. Today is not March the 28th, obviously. This is for a previous video probably, but I put in today's blood pressure and I just made it up, of course. And I wanted to test something in the measurements, and I will not apologize for the fact I'm using Grease Monkey, which is here, and some of you may recognize that. And don't get paid to plug this, but if you recognize it, you know what that is. My vital signs are linked to this Grease Monkey button here in the corner. Sorry, I'm going to get a stiff neck going back and forth. Or you can bounce on the head of a pin, hover over the plus sign here, and gently navigate down to the vital signs. I have many measurement groups. I'll address that in a moment. You can open up your measurement groups here. So today, April the 11th, I added this pretend blood pressure, and I added this comment that says blood pressure, and I use special characters, greater than, less than, just to see if this would break the comment. Those of you who actually add comments here, and generally what I do here is I have a fancy blood pressure cuff that does averages. I'll put in the 3 averages. I'll just make this up. For the systolics and such. This is a clinical thing. Sorry for those who are not clinicians who just want to learn. But you can add important things like maybe this is a blood pressure measurement that was supine or standing or so on and so forth. Maybe your blood pressure group here has 4 readings, BP true, sitting, standing, whatever. Maybe you don't want all 4. And again, I'll address that in a bit. What I want to illustrate here with these special symbols is in the past, if you added a special symbol, it would break the comments. It seems to have been fixed after 15 years or so. If your comment section does not allow special characters, and it's usually something like a greater than or less than sign, then don't don't put it in because it'll create funny characters, and that's just the thing with programming. If it's been fixed, great. It was a long time coming. Okay, so what I did was I actually saved this blood pressure. It's on the wrong date, and I want to show you something. If you added a note on the wrong date, on the wrong chart. Don't just close the chart. You can close the chart. It's going to save that. You want to exit properly. Here's the exit icon. Not part of measurement, but good EMR etiquette. Exit properly here. It says, do you want to really exit without saving? Because you're going to lose that data. It's on the wrong date, in the wrong chart. I'm happy to lose that data. Okay. That's used frequently when I add old measurements. I'm going to get to that in a second. So hopefully all you know to add measurements in this fashion. I'm going to go back to Shawnee Rotan, open the chart, and hopefully it's today, April the 11th. Hooray, it worked. Okay. You can add blood pressure the old-fashioned way and treat your Oscar EMR as digital paper. You can write blood pressure 120/70, and that'd be perfectly fine, but it is not making the best use. This is what I was emphasizing in my Oscar YouTube video, Measurement Basics. You are better off to do it backwards. Instead of adding it here initially, I'm going to do this the old-fashioned way. Hover over that head of the pin, find your vital signs, and add another measurement, 120/90. If it's not in the right format, it will not accept it. So if I try to do that, it's not a valid blood pressure. It's missing the division slash. Okay, now it'll accept it. And if you do that, it goes into the chart, excuse me, there, 120/9. So type it in once, type it in measurements, and add it there. And that's pretty much all I'm going to say about that, because hopefully you already know that. If you don't like where it's positioned, it's always at the bottom of the note, reposition it. Cut it here, paste it there. Oops, I didn't paste it there, that sort of thing. Okay, it gets way more complicated than that. Obviously, you can do things that are easy, and we often take the easy way out. It's not easy for me to hover over this plus sign. It's a lot easier to click on that, and it's a lot easier if there are different groups. So that's part of, making your Oscar easier to use. And I'll show you where that happens, okay? It happens in your admin area. So here, admin, you click on that, you'll get to the main admin. It's under system management, and hidden in this random list of things under system management is custom measurements. If you click that, you get all this stuff. And those of you who have ventured into this area, good on you. It's very confusing. There's only a few things I use on a regular basis because I seem to have some understanding and control of it. A lot of it is still a mystery. You can see every measurement available if you click on view all measurements, obviously. And here it is, entire list. And I want to highlight some things here. There are 1, 2, 3, 4 main columns: type, display name, type, again with a description, measuring instructions, validation. This type is a identifier ID. You can see it's blue. If you click on that, it's a hyperlink, and it gives you some programming stuff. And I'm not going to say any more about that other than this will capture any entry into this particular measurement. And you think this would be alphabetical, sorted in some logical manner, and it kind of is, but not in this column. It's sorted by display name, number of exacerbations, the number 2, the number 24, so on and so forth. Okay, so how do you get 4 different blood pressures? You normally cannot. If you create a new measurement, you have to create a unique ID, and you can't have 2 the same. So let me just go back one step and show you an example. I've actually removed a lot of the multiples and changed a lot of the validations because I didn't like how it displayed. So here is, I'll go the easy way. 1 blood pressure measurement, not 4. I have two oxygen saturations here. You know, you get two options. You can label it as a percent or as a percent. It says oxygen saturation. Why are there two? It's because there's a display name, oxygen saturation, that's in twice. Let me find that for you. Here again is that screenshot of the measurement types. Here are the hyperlinked unique ID codes, generally limited to 4 characters. But you can see this is aircon, air conditioning available. This is a relatively new one, and that's got 6 characters. My vendor expanded that to accommodate more measurements. Great. So there is a set of measurements here, way down the list that says oxygen saturation, oxygen saturation. Your display name allows for multiple options. But there are 2 hyperlinks to that. Why? Because somebody created one, didn't know that the other one existed. Now, this is kind of small print. It's kind of weird. This is O2, and this is O2SA, but it's actually not the letter O. It's the number 0. So if somebody didn't really take chemistry 101, oxygen is not 0. And this is embarrassing. And it's a legacy item that I don't know if that ever get fixed. Somebody really needs to review this, somebody, not me, and find out where all the redundancies are and put some logic to it. Okay, that's a huge project. Somebody should do that and then update all our EMRs to a standard. Standards are good. Consistency is good. Having 10 different ways of capturing smoking is not good. Guess which one is the right one? Okay, so that I think is important to know. To make life easier, you may want to create measurement groups. And you saw in my nice chart again, Johnny Rotund, I have too many measurement groups. I have balance on that head of the pin. Allergy, OBGYN, serology, psychiatry, tumor markers, on and on and on. This is just because I need an easy way to capture certain data that was important in my practice when I was doing obstetrics, my complex care patients with COPD, et cetera, et cetera. You may have Oscar with measurements that include vital signs, maybe 3 or 4 items. I have about 20. And of all things, urinalysis. I don't know, somebody thought that was really important to capture urinalysis. Even my own MOA wonders, why don't we have a urinalysis measurement? I just have to check the boxes, you know, the WCB and RBCs and so on and so forth. I never thought that was helpful. And if you think about it, do you really want to track, you know, nitrites over time? Does that really help? They didn't want to type it in manually. They thought measurements would be helpful. I may be wrong. I'm not the MOA doing this, so I hope to get some feedback from this group. So that's where I hope to learn a bit more. Okay, so this is really important. If I go back to the admin panel, this is very confusing when it says type, display name, and then type again. It is used in the different areas of measurements, and I think I can maybe show you. Measuring instructions are very helpful, but they often have a lot of unwanted information. Everything here under measurement instructions gets pasted into your chart. So for my blood pressure, it says sitting or average because I have a blood pressure machine. I usually quote the average. I usually do it in a sitting position. Okay. If you want to get rid of those multiple blood pressure options, because if you're like me, I always pick what I think is the fastest line at the cashier, and it's always the slowest. It's always defaulted to the wrong blood pressure measurement. How do you get rid of that? Well, you get rid of it by checking, and I'm not going to do this, but I'll show you how. There's a last column here that says delete. You check that to choose what you want to delete. And way at the bottom, there's actually a delete button. Okay. You may or may not get a secondary warning that do you really want to delete? And that's why I say it can be very dangerous to do this. I'm going to get out of danger. But if you have 4 blood pressure options and you only want the one, you would search for BP, and it won't be alphabetical based on here. I only have the one BP. It's this one. And you may have 4 of them. You could pick off the ones you don't want, pretend this next one is also BP, and so on and so forth. Leave the one you do want, go and delete it. Bob's almost your uncle. Now, what happens if you delete the whole kit and caboodle? The data you saved already is still there. You just cannot see it until and unless you create a measurement, this BP again. You cannot create 2 measurements with the same ID. You can create 2 measurements with the same, wait for it, display name. It's super confusing. They need to be a little more direct in this, and they need to put this row title and mix it in with the rest of this list, because there's probably like 200 or 300 measurements here. Okay, so what if you want to create another measurement? Just for the sake of argument, let's create a measurement. Add a measurement type, and now you get this. And the type is indeed that unique ID code. Let's recreate blood pressure. It's not going to work. I'm just going to try blood pressure, display name. Oftentimes, the type description, display name are the same. And if you do that, you don't know, well, maybe it doesn't matter because everything says BP. Okay, I'm just going to add something there. I don't expect this to work. Validation is important. This is a fraction. This would be just text. Blood pressure has built-in criteria. Okay, it has the slash that separates the systolic from diastolic and so on. It has a valid range. I can't put in 1,000 for systolic. It just won't accept it. Maybe it'll go up to 200. I don't know what it is. It's programmed in. But if I try and do this, it probably, and it should not work because this measurement already exists. You cannot have 2 ID or types that are the same. You have to create something else, give it another name, BP2, and then it'll do it. If I do this, I'll delete it later because I really don't need it. Okay. And the measurement instructions, you will have complex instructions that will tell you what the range should be, how frequently you should measure it, measure in inches, and so on and so forth. If you have a weight measurement that says in kilograms, it'll say something like 75 in kg. Maybe you only wanted to say something like weight 75 kg. You need to edit that bit of the instruction, okay? And you may or may not have that capacity. I didn't have that capacity in the early days. What I had to do, and I'm going to go back to this to show you. Wait for it. Find weight. That's WT, and there's lots of reference to WT. And I think this should be near the bottom. Wait, here we go. Weight, kilogram, kg. That's kind of small. I hope you can see it. I can't scroll up anymore. It's at the very bottom of my list. But if yours says in kg, you might want to get rid of the word in. It should have a numeric value between 0 and 300 because anything can be negative. It can't, hopefully not over 300, and so on. You may have a measurement for weight in pounds, and I think I have that too. Weight LB, weight pounds, and it just says pounds, so that if I were to add that measurement, it would simply say 140 pounds, and so on. Okay. So if you want to edit this part, and anything that says instructions, you had to, in the past, delete this, literally delete it and recreate it. So that's a scary prospect because if you have a memory of a goldfish like I do, you may forget what the unique ID code is. So This is a whole lot easier to do and safer to do now in the system that I have, and it is here. Edit measurement type. If you have this, hooray, this makes it a lot safer. If you don't have it and you're nervous, maybe ask your provider to do it for you, your OSP. Or if you're brave and you have a backup plan, like take a screenshot in Hint so you can recreate it exactly as you want, minus the instructions. So select the type. This is the unique type. And it looks like it's in the order presented. So it's under the W's. And what did I do? I just typed in the letter W on the keyboard, and I'm just going to keep clicking until I get to what I want, which is probably in this area here. That's a pro tip. Big drop-down list. If you know the word you're looking for, the first letter will at least get you closer to the area you want. So this is the description name and the measuring instructions. Yours might say in kilos, and all you need to do is take that out. Take out anything unwanted that you don't want pasted in the chart. Validation, obviously, you can choose whatever you want. No validation means do whatever you want. Free text. I don't know why no validation is in there 4 times and the next one is in there 3 times. That's what the programmer said. And you can see there are different unique validations. Some are just limited to a range between 0 and 1. Some are integers. Some are, I've never seen review. Some are the status, yes, no, maybe. I like this, yes, no, and X as in previously. Yes, I smoke. No, I don't smoke. I'm an ex-smoker, and so on and so forth, positive or negative. Some of these are obvious. Date format is the universal date format, year, month, day, hours, minutes, seconds even, and that actually comes into play at some point. Okay, so that's that. If you have this, you can go to town and fix all the measurement instructions that you don't like. And it is easy, but time consuming to do. If you trust MOA to do so, maybe your senior MOA, then maybe let them do so. Obviously, anything that you measure as a number, you should be able to graph. Anything that is free text, obviously you can't graph words. What's a good example? Fasting, blood, plasma, I don't even know what the C means here. It will add in millimoles per liter, whatever the number is that you add. Maybe you don't want that. This one obviously is not meant for clinicians, it's meant for a clinic. Application for social assistance, pink form filled out. That's a pretty long title, and it's going to paste application for social assistance in the chart every time you do it. So again, have a look, see what you like from a format standpoint. I'm a bit OCD about, having it look like I meant to type it that way, and sometimes it doesn't make sense. This one has a range. And do you want that in your chart every single time? Maybe you do, maybe you don't. Okay, I'm going to stop there and go to another important area to make life easier with measurements. Measurement groups. I'm going to show you all the measurement groups I have. It's way over here, and it's alphabetical. Allergy, so on and so forth. Okay. There's one that we created custom for, this is BC, for ICBC stuff. All the CL489s that require claim numbers, vendor numbers, and so on. Date of accident, you can capture it here. And we custom made that. And there are many measurements that you may have to create to make eForms work. My partners did not like the fact that I had 20 items in vital signs, so they wanted a simpler vital signs. So we trimmed it down to the bare minimum. So I'm just going to show you what that one looks like. Modify measurement types, modify style. I really don't know what that does, but if you want to change a measurement group, you hit modify type, and this is what you have. These are all the measurements here on this side. These are the ones that are in simple vitals group, and that's all there is, right? If you add AFP to this, so highlight that, add, it will go to the bottom. And unfortunately, I wish there was a way of dragging and repositioning the order, but there is not. Last to add goes to the bottom of the list. First goes to the top of the list. And if you like a certain order to things, you can set it by recreating the group. Just delete everything and add it back. What happens to the measurements collected in there? Nothing. They're still there. This is how you just display it. So I'm going to take this out because it doesn't belong. The problem is the types are the names and not necessarily the ID. So if you're looking for pulse, you can't find it easily. And I show you the trick where you type, the first letter, so P, and these are all the P's. This is not alphabetical. Look, K next to potassium. So it's a matter of just guessing, hoping. And pulse is terrible because pulse P is also an obstetrical abbreviation for pregnancy. And I'll just jump to the punchline. Pulse is not under P, pulse is under H. HR to be exact, and eventually I'll find it. I won't find it. You know why? Because it's already here. Heart rate. So it's not the best labeling, and there's a lot of guesswork. But once you get it right, you got it right, and you don't have to worry again. How do you create a new one of these if you want? Well, you basically go to add a measurement group. Be very thoughtful about what you want to name it, because you can add one and you can't change the name easily. You have to delete and start over again. I really don't know what the drop-down menu does here. It doesn't seem to do anything, but you continue and you'll end up with a list of all the measurements on one side, the left side, and the ones you want to add. Think of the order you want to add it in. Now, there's a feature, at least in my version of Oscar, that allows you to sort alphabetically. And that's good because as long as you know that W will be at the bottom and B will be at the top, blood pressure is first, weight will be, at the bottom. But I like to group things in a logical way. And I think that's very, very helpful. The best example of that grouping in an illogical way is the built-in measurements, AKA known as flow sheets, hypertension flow sheet, diabetes flow sheets. These are just groups of measurements. Here's the diabetes one, has blood pressure at the top, and you think A1C should be like really close by. It's there somewhere down here, okay? And with all measurements, you can track things over time. This is what happens if you click on that little graph. This is hard to see, so I'm going to zoom in. There. A1C is the name. This is time, and there's only a couple of data points. So that may be helpful in certain contexts. It isn't always useful, but knowing that it's there gives you some power depending on how you want to wield it. Okay. But in Johnny Rotund's chart, that was A1C. You can also click on the lab result here. And you'll see one of the results. If you click on this and dive in further, you'll get, wait for it, this report. And A1C, as well as many other lab measurements, lab values, comes in through your inbox automatically from Accelerate or whatever. It will go automatically into your measurements. This is a little slow. We'll get back to it in a second. And that's great. But there are some that don't automatically download. And that's a really difficult thing to do on your own because it involves mapping. And I think that's one of the questions that the attendees pose. The mapping is not easy to do. It's very complicated. And again, having done it and failed on it multiple times and randomly managed to make it work, I say just know what you need and what you want and ask your provider to do it for you. And hopefully they'll do it right. Okay, are we there? Oh, you only have the one value. Okay, I want to show you an example of where as much as I like to see it work, it doesn't work. And that is related to validation. The clinical context is a test result that will automatically go to measurements. PSA is automatically pushed to a measurement. I create a way of displaying PSA as well as other tumor markers. It is literally labeled tumor marker. So our pretend patient, actually all my patients, the entire clinic has this option of adding tumor markers. And most of these auto-populate if the results are from the lab. In this case, as a pretend patient, we manually added these measurements. So here's a PSA. Somebody put in 0.05. The last entry was 2008. This little clock allows you to show old measurements. There's only two, and of course you can graph that. There, two measurements, one high, one low, just so you can see. Okay, let's close this. Go back here for a second. What happens if you actually want to add another measurement or delete a measurement that's wrong? You basically select the measurement that's wrong. Okay, it disappears from the display. The value is still in the chart. You just don't see it as such, and you hit delete. I'm not going to do that, but I will show you what manually adding a PSA does. So because I have the measurement group tumor marker, I'm going to add a PSA today of greater than 9. I'm doing it on purpose because it won't like it. This wants a number. The validation, it has to be a number. And the greater sign, oh my goodness, it took it. All right, let's see what happened. Oh, it took it. Somewhere it got changed and it was allowed to have no validation. But in general, it won't allow for it. Like for weight, for example, you can't put any special symbols in. Okay, that really shouldn't happen. The reason I thought this is going to cause an error is it should just be a number, but how often do we see a number less than 0.0008? Somebody who had cancer and was treated has basically a PSA that's below threshold. So let me see if I can demonstrate that for you. This is a bunch of PSAs that came in through the lab. I hope you can see this. And the value is less than 0.08. However, I manually change many of these to 0 because the instructions are change to 0 if, here go instructions, if less than 0.04, so that I can continue to graph it. Otherwise, with less than 0.008 in there, it will fail to graph because you can't graph a symbol. How did it get in the first place? It got force fed in there by the lab. So the lab has a part to play in this. If they are supposed to give us a numeric value and they give us a word, a text, a warning in that field, it's going to wreck our ability to graph. And so, you know, you're stuck, which is why you can manually change it or not. Okay, let's go back to this. So create additional measurement groups that'll help you get access to the things you need. What did we do? Well, I showed you our ICBC measurement group. It has a claim number. It's going to be the same claim number until you're finished with that. I hope you don't get to another accident. A vendor number, which ICBC wants, so they can pay you. The date. Where does this come into play? Well, if this is our patient, and I'll just show you an eForm that uses this, CL489. It captures it here. Claim number 1234, accident date. This weird format, which is not the format that not the internationally accepted format, is backwards. Why do they do this? Because they can. So there's the 1234. There's the accident date in the proper ISO 9000 format, year, month, date. Okay. That just makes it easier to fill in these forms. There are many forms that pull data. The one that we use the most, that our MOAs use the most, is when they measure weights and heights, and you get a BMI out of it. So you can do that. You can do that somewhat easily using what already exists in Oscar, this CDM indicator. It has weight in kilos, so I'm just gonna make up 76. It has height in centimeters, so I'm gonna say this person is somewhat shorter, and then it automatically captures the BMI. This is not a chronic CDM, chronic disease management flow sheet. It is a diabetes management flow sheet. Look at all the parameters, look at all the measurement types. They're all diabetes related. Anyways, if you do all that, you're not done yet. You have to go all the way down to the bottom, submit and close. And there's your weight, height, and BMI. Doesn't say in kilos or anything else for that matter. So how do we do it? We do it differently. There is a great eForm. It's called BMI calculator, and it looks like this. Now, our scales are in pounds. So I'm going to make up a different set of weights. I'm going to say this person weighs 160 pounds, but if you double click that, it will convert. Double click, convert. Okay, so numbers are a little bit different. And it will convert imperial heights, 5 foot 6 inches, to feet. So centimeters, sorry. And then it won't automatically calculate the BMI. You do have to click. And yes, is it worth all the hassle? It will be. I'll show you why. Because you can write and submit this data into the chart. Where is it here? And it'll give you this pop-up. It's a weird kind of backwards warning. It says, do you want to replace? And replace is spelled wrong. I just noticed. You would think it's hit OK, but you actually want to hit cancel. And so what did it do here? It added heights and weights. It's 167 centimeters. Oh, it also tells you what it was in imperial units, 5 foot 6, because you know they're going to ask. Okay, so we prefer to do it this way. And did it go into measurements? Yes, it did. It will be there. Okay, trust me on this. So we don't use the CDM. We don't just type it in here. We put it into the BMI eForm. We save it, submit it, hit that cancel button, and it's here. Okay, if you don't want to see it here, because it's not part of your note, well, you can finish your note and you just delete all this. I mean, obviously it's good to have it in there. Okay. So some of the things you are doing probably makes sense if you were doing on paper just to write in progress notes. But in EMR, you kind of want to use the tools that are available to you to make it way more useful. You can create measurement groups. You can sort things in your groups. You can edit the measurements specifically, the instructions, to make it look nice. And I think we need some standards. Somebody needs to go through that 200, 300, 400, line list of measurements and tease away the ones that are redundant and confusing. Why do we need 2 oxygen saturations? We should have 1, and so on. There are going to be missing measurements that you might need because you're doing a special project, or you may have some special patient population to manage. Maybe you have a high incidence of hepatitis B patients. You want to track those who have DNA values to look up and so on. You can create those measurements. They may already be there. There's a lot of mental health measurements that don't exist. If you do a lot of psychiatric work, you may need that, and so on. Measurements can get pushed from an eForm into the measurement area. It can be pulled. This one, I'll just show you the BMI one again. So it's blank now, but if you want to see previous measurements, the last measurements were this, and this is the date, okay? The date actually goes down to the second, but we scrub that out because we don't really need time. It's just a little bit too much, all right? Those who are doing eForm programming might think this is great. I'll just add, desired measurements in the form, and then it'll automatically go, just like this one. but actually it can have some unintended consequences. We can talk about that in another session. I think that's about it for now. I don't know if I've used too much time or too little time, but I think I might just want to stop there and field questions and see what's out there. Hopefully, I don't have you all scratching your head and wondering what happened. Let me stop sharing for a moment and see where we're at.
Okay, thanks, John. That was great. So yeah, we're kind of good on time, running a little over, but we're good. So we did have one comment in the chat box about editing or deleting measurement, and that, and this is from Marlies. It will remove all the previous values you've saved under that. So I'm not sure if you covered that or commented on that. So
That was a huge fear of mine. Like, what about all the blood pressures I've checked over the many years of that one patient? How about all my patients? No, it is in the system, labeled under that type ID, that hyperlink, and it will always be there. You just won't be able to see it easily unless you recreate it. And the trouble is that too many cooks in the kitchen concept. Some people didn't know that particular measurement already was created, so they created another one. The best example, expected date of confinement, EDC, and expected date of delivery, EDD. We have both of those in the system. And so we had to pivot a little bit and make a go around, because some people use EDD as their due date and EDC as their due date. So our calculators that required one of them had to acknowledge that the other one also may exist. So it looks for both. It's a nightmare. Somebody should have said, this is the one standard to stick with. There are many examples of that, unfortunately. Where this goes sideways is, again, if you're a clinician, you'll know that troponins can be tracked, and you used to be able to graph that if that was important. Troponins are now coming in 2 different flavors, if you will, 3 different flavors, and so you can't get legacy items there because the lab decided to create a new ID code on their side and didn't bother telling us. And there are a lot of examples where things would graph properly, like GFRs, and they stopped because they put a comment in that numeric field instead of adding the number. It could be something like, maybe it's a child and the GFR isn't valid. So regardless, there are things beyond our control that mess up the things that should work. I'm going to scroll through the chat and see if there's anything else. Yeah, so if you're worried about where the measurements go, you cannot delete saved measurements. You can hide them inadvertently. You can redisplay them if you know what the ID is and you accidentally deleted that. If you're not sure and you don't want to make a mistake, you pay money to have your Oscar system supported. Ask your support team to do it for you. Be clear in your mind what you want, though. Okay, and they may be able to redisplay it for you, recreate that measurement, or maybe create a new measurement. Maybe you do want, the ICBC stuff if you are using a CL489 form. Maybe you do want to track those patients who are at high risk for heat dome events. That's why we created the air conditioning one, although it looks like my vendor created another more complex one. There are different ways of tracking. I have a whole slew of serology measurements that did not exist, such as, hepatitis B stuff, HIV stuff, and I do prep work, so I need to track all those serology parameters. The cancer tumor markers are nice to have, and so on.
okay, great. Thank you. So can everybody see the whiteboard that I've shared? Is this posting for everybody? Can just do a quick thumbs up in your raise hand option. I see a couple of people roaming around in the whiteboard trying to figure it out. So I'm going to turn on my laser really quickly because we're going to open this up to everybody should have editing access.
Mhm.
Turn my little laser on.
So
Where's my laser?
while you're doing this, one of my roles obviously is to teach. I teach at the Faculty of Medicine, second and first year medical students. I teach residents in family practice. I also teach fellow physicians. The PSP has me on as a mentor, and I have people asking about, how do you transition from NTP billings to LFP billings? What do you do within Oscar to make life easier? Obviously, nobody taught me how to do this. We had to kind of make it up as we go. And sometimes the direction I head in isn't really the best direction, which is why these sessions are so important. And how when I teach, I learn as much as you get as much as you give, literally. So I think our shared wisdom is way more valuable than a developer, creating a feature that may or may not fly.
Okay. All right, so I'm gonna run around here really, really quickly with my little red laser. I hope everybody can see that. Here we have some post-it notes. You can double click on an open post-it note and add in your comments, questions around challenges, the same in best practices and tips, insights and your aha moments. And then if there's something that comes up that can't be addressed today, we're going to put it into a parking lot and save those for the next session on measurements that we will likely do because we anticipate there are going to be questions that can't be answered in one session. Measurements is a big topic. We have some interactive emoticons on the left-hand screen. Again, everybody should be able to zoom in and out simply using your, for most of you, control and scroll. But there's also a view that you can do down here on your bottom right. So you should be able to type in your post-it notes. If you run out, you can add one. So I can click, and if I turn off my laser, I can drag, click, drag, and add a new post-it note for myself. So if there's any confusion, again, this is kind of new for some folks maybe, but make a mess with it. I don't care. It can always be cleaned up. So at this point, I think we'd like to open it up. Everybody who would like to jump in, we're going to open it up. The first folks we'd like to hear from at this point is from our MOAs and from Oscar users on one of the things I think we wanted to address was version differences that might appear. So Linda, I don't know if you have any thoughts because you're on on Juno, I believe, version. I don't know if we have any open OSP users that might have some insights into this as well.
Yeah,
Um,
I'm
yeah,
curious, how many people have an edit function to measurements? Because I know that you want to do that edit. I know you probably want to trim down your blood pressure list and maybe save just the one that has blood pressure sitting. I mean, you can always add in the comment that this was a standing blood pressure, or you can add a comment that your postural blood pressure, like you did one sitting, that's the captured value. And in the comment, standing was this, and you can see the difference. And it will be pasted into your chart, so you don't have to type it in twice. So who has the edit function? Because I hope that all of us have that and not just the well users.
so anybody you can all unmute yourselves and jump
Yeah,
in the conversation, please.
I don't want to drone on and on, but I will if I have to. There was a clinic I supported. This is in the fee-for-service days. Back in those days, we had incentive fees for doing guideline-based care. And there was extra money to be made if you had diabetics, hypertensives, and so on and so forth. And it was worth it because we're already doing the work. We just want a checklist of things to ensure that, we were keeping up. So one clinic wondered why they didn't have a hypertension flow sheet with any data in it. No blood pressures in it whatsoever. It says, well, how do you capture your blood pressure? Well, you just type it in the chart. And so for 10 years, they had all the blood pressures in the progress notes. And that's great. That's how we would do it if you had a paper chart. You have an EMR now. They had no idea that they should be doing it in somewhat reverse order, putting in the measurements first, which is why I made that instructional video, measurement basics.
Okay, Cam, I think you unmuted. Did you want to jump in with something with
No,
us?
sorry, it just prompted me to unmute and I clicked it. My bad.
Okay, you have nothing to add. Okay. Linda, do you have any comments at this point regarding using a different format or a different version of Oscar than what Dr. Yap presents?
Yeah, I use Juno and I find that Juno is quite similar. I often use the blood pressure measurement where I input it and directly copy and paste into my chart. It doesn't actually say standing or sitting. It just copy and paste another one value. So if I do standing or sitting, I would have to type the second one. So I think listening to Dr. Yap's presentation today, I'm going to check if I have that edit button so I can edit the measurements. I also often get the MOAs to use the height and weight and BMI check too to monitor patients. Yeah.
I'm curious though, for those who have a blood pressure measurement, maybe a vital signs group even, how many blood pressure options do you have? Because I start with 4
Mhm.
and I've like eliminated all but one.
Yeah. It's interesting. I have one. I only have one. Yeah. Yeah. Yeah.
So how many out there still have 4 and it's always defaulted to the wrong one?
Yeah.
Because you can fix that.
I
And
have 4. I would like to change that.
you can do it. Here's the thing though, and I didn't demonstrate this, but I'll say it now. If you have and I'll use blood pressure as an example, blood pressure in a vital signs group, it may also be in others like a hypertension group and so on and so forth. You can have measurements in multiple groups. It will still be the same value. You can enter it from any group you wish. It will cross over to all of those other groups. However, if you end up deleting any of them, they will disappear from that group, which is horrible because you went through great pains to create that in the first place. When you recreate it or edit it or whatever you needed to do, you may have to add it back, which is a real hassle. And the thing I learned is a memory of a goldfish. I can't remember what was in each group. So take a screenshot of your group and then recreate it accordingly, knowing that we need one essential feature that doesn't exist anywhere that I'm aware of. And that's the ability to manually sort once you create it, because the last thing you add goes to the bottom unless you choose to sort alphabetically, which is an option in Well. I don't know if it's an option in other versions, but at least, you have that sense of control, which isn't really control. It's based on sorting alphabetically.
Okay.
So I'm curious because when I mentored these other clinics, they had a minimalist set of groups. They had vital signs that may have had like blood pressure, weight, height, waist circumference. And then they had urinalysis. So how many clinics have a urinalysis measurement? And my question is why? There may be a legitimate reason. I just don't understand it myself.
Mhm.
Does anybody want to chime in on that? What are the measurements that you use like day in and day out? I know mine's blood pressure.
Mhm. Mhm.
In the staff, probably BMI, weight and height.
I think I I do check A1C trends, but it would be nice to see that in a graph that you showed. So I think I'll explore that option in the future. So last year I had a question. I was thinking I have a small patient. I was thinking how many of my patients have diabetes and how many of them have their A1C updated. So I reached out to doctors of VC for their quality improvement coach to guide me on performing a project. And they helped me recognize kind of the first two steps of getting a accurate measurement. We need to do a good panel cleanup. And then we also need to ensure our disease registry are up to date. So for instance, there are patients that are listed under type 2 diabetes, but if we go under reports by template from the Juno section, I had a whole group of patients that says consider diabetes, but I have never updated them in the disease registry. So I had to then manually do that and then review the patients that had outdated A1C, call them back and then to urge them to do their A1Cs on time. Also use electronic reminders for that too. So I think probably for me to think about like the whole thing about ensuring we have accurate measurements is ensuring that our panel's up to date and our panel's cleaned. Yeah, yeah. Oh, sorry, you're muted, Dr. Yap.
My bad. There are so many interdependencies in an EMR that if you don't appreciate why it's important to capture data in a certain way, it's extra work. We never had to do it before. We had a piece of paper, we signed off on the note, we put the chart away and never had to look at it again. But we can do these higher level analyses, such as what you just hinted at. How many of your diabetic patients you haven't labeled as diabetic, but maybe when they are in front of you, you know they are,
Yeah, yeah,
may not have had an A1C in who knows how long.
yeah.
The EMR knows as long as it captures the data, as long as you capture the data. Now, it does a lot of the capturing behind the scenes, which is great. Some of them do not, and I think it could be easier. And the examples I already pointed out, like blood pressure, A1Cs automatically go in. You know, I do add in select patients old data. A new patient comes in with prostate cancer. I want to know that their PSA was 50 when they were diagnosed 10 years ago, because it becomes 50 again. It means something important, and so on. I think we can use measurements to our advantage as long as we know, it's there and how to use it. I think we need vendors to do better. And some of them are looking at this. I mean, it's work that they don't get paid for, so to speak. It's there to clutter up the system. It's there for us to make a mistake. There's a measurement called HIV. And the answer, the validation is yes or no. No context. So what does it really mean? And I honestly don't know. So I don't use that measurement. It's too ambiguous. HIV antibody, I will know. It either is a number or it's zero, okay? And that sort of thing. But there are many examples where it's ambiguous or it's a stream of text that, somebody thought was important in a multidisciplinary clinic. And would I ever use it? I think about 30% of the measurements in my system, I will never touch. But if you accidentally use it, what happens? Because you can actually undo a measurement, delete a measurement. You have to do it. I showed you how to delete a height that was incorrectly inputted. I put in a height as in meters and it needs to be in centimeters. So I had some weird BMI values because of that. Anyone else want to chime in? I mean, this is where I'm hoping to learn as much from you as you learn from me.
Absolutely. I posted some questions in the chat
Oh,
if you'd
okay.
like to just review those. I'm wondering, is everybody have editing ability on this whiteboard? You should. So
Yeah. Which measurements are most useful in workflow? Obviously, it would be vital signs, your blood pressures, your pulse. So note that in CDM indicators, which every chart has, and know that it's not chronic disease management, it's actually diabetes management. There is a blood pressure option. There is no pulse option. So what I saw happening, because people didn't have a proper vital signs group, they use CDM indicators because they existed in every chart. they would put the pulse in the comment. Okay, that's fine. Except that's not where it belongs. You know, you shouldn't put your socks in the cutlery drawer. You need to put it in the right drawer. And you might want to comment that the pulse is regular or irregular or whatever, because that matters. Okay. So use a good measurement group. Create one that will exist for the entire clinic. Tell your office partners where it is and how they should use it. You know, the workflow is not intuitive, but once you get the hang of it, it becomes the new normal. That becomes uh, the only way to do it. What barriers exist for capturing accurate data? The data that comes directly from the lab, it cannot be more accurate. The dates are going to be correct, and the value is going to be correct, save for the fact that they sometimes put in a special symbol, which will wreck everything you prepared in advance. I noticed, and I demonstrated it live to some embarrassment, that the PSA did allow me to put in a symbol, and normally it wouldn't. And I have to double check that, because you shouldn't be able to add in, you know, a symbol. It should be a number, which is why I added that comment, the instructions to change it to 0 manually. What customizations, automations have improved your process? There are many. Many of them are okay or perfected already. Some that don't exist. The fit value, FOBT, before fit, wasn't a measurement that mapped. So I had to connect that, map that, so that the value would actually go into a fit measurement that I had to manually create, newly create, and then it would display. It was all fine and dandy, except it used to be a numerical value. Over 50, I think, was a cutoff that was positive. Under 50 was negative. So it changed. It changed to a positive and negative. So I had to change it. And a numerical value was no longer valid. It had to be no validation or text. So you know, that's why you need to be able to edit that. Otherwise, it's a broken link, if you will. You lose that. And that there are many examples over time where that happened. Are you using measurement data in report by templates to actually make it useful? For example, when the previous person mentioned trying to recall and track. Yes, report by template is just a way of displaying something. And that something is captured in the various areas in Oscar. They're fields, if you will. And yes, a measurement is a field that you can capture. You just have to know the name of it and where to find it. So yes, the dashboard is just a fancy way of mining your data, as long as you put blood pressure where blood pressure belongs. If you just put it in the chart, it can still find it, but it's the least efficient way of finding it. Can you imagine trying to look up when the blood pressure spiked, and you have to search your entire progress note for, you know, when it was a certain level? Yes, you can do it, but it's the least efficient way of doing it. If you have a summary of all the blood pressure readings, you'll see it in an instant graphically. Yeah. The dashboard was a response to the dashboards created by another EMR I will not name, but they had a really fancy dashboard. And so we, through Oscar, at the time, maybe it was Oscar BC, we hired a developer to create an equivalent dashboard. It turned out that much of those dashboard items were already there. They just need to be enabled and displayed in a user-friendly way. So that's what a dashboard is. If you know what report by templates is, not the subject of today's lounge, but maybe a future one, you'll know that it creates a very crude-looking spreadsheet-like report, and that's great. But it's a lot more user-friendly when you add on certain filters and certain tasks attached to that. So the dashboard will allow you to, for example, recall in batches groups of patients that may not have had an A1C, and you know, you set your time frame 6 months, a year, or whatever. You may have other things you want to track, and you can ask. Doctors BC has a great technical person who knows Oscar very well. I'm really impressed. You can ask them. They won't charge you, and they'll just do it. It's free. I mean, you can ask your support vendor as well, but I don't think they consider that a priority. Um, and the problem is the blessing and curse reference. If you have created a measurement that's not conventional, that works for you, it may not work when you use someone else's report by template.
Mm-hmm.
And there was a time where I was trying to help a Juno clinic. This is long time ago, where the report by template worked just fine in my system, which wasn't well at the time, but just crashed in Juno.
Mm-hmm.
Now that's not necessarily a good thing. Well, it's not a good thing for sure,
Mm-hmm.
because in order to share data, and that may be the S5 thing that we referenced at the very beginning of today's session. We need some standards and ability to share information, not just within our office, but outside our office with the health authorities, with other specialists, and so on. We do need to be connected better. We need to be connected safely and securely, and there's obviously concern about
Mm-hmm.
how safe it is to do this, and it's not a thing that I have any control over. I just try and do things, in a common sense way.
Mm-hmm. Mm-hmm.
Okay, thank you. The S5 thing you're referring to is the Connected Care Act, which was recently put to the Florida Parliament, and presumably will be discussed further. It didn't go anywhere. It was kind of, I believe, a pullout and introduction of a previous act that was introduced, 2024, I believe, maybe earlier than that. But it didn't go anywhere because Parliament prorogued. So it's been kind of tweaked and will continue to be tweaked, I'm assuming. We'll hear more from Kathleen, I'm hoping, on June
We
13th.
definitely will, but
Yeah.
I think you need to reflect on your own practices, your style of practice, especially how you collect data. That it's
Yeah.
going to be ever more important to kind of learn what the standards might be, or create our own if it doesn't exist, so that we can be leaders and not followers. Right now, it's a bit of chaos. It's a bit of a nightmare, that we can't speak to each other because what I call this measurement is something else in your system, and it affects patient care is what it comes down to ultimately.
Yeah. I wanted to just mention the 3 questions that I posted in the chat. I was hoping that the group would also be kind of inputting on those questions. So from the participants and in real life Oscar users, especially regarding barriers that may exist for you in capturing accurate data. I think you've addressed a little bit of that. And then what have you made any customizations or automations that have improved your process and measurement? So we would love to hear that from all of you as well, if you would like to jump
I
in
think
with
I
them.
throw a challenge there. Look at what measurement groups you have and think of what you might want to have and how you might use it. I think I know what my future YouTube videos might have to be related to this topic. And that might be, just create a new measurement group, add some measurements to that group. And maybe this only applies to those if you have the edit function, because I actually don't want to show you the old-fashioned way of deleting the entire measurement and recreating it from scratch. I think that has too much risk. So that may be your motivation to lobby your vendor if they don't have an editor to add it. The whole point of Oscar is to share the development and improvements, and to a greater or lesser degree, it has been done over time. That's something that I think needs to be there for everyone for safety. And then at some point, hopefully they'll confer and agree on some standards and create a group of measurements that is workable for all of us and is inclusive of all the things we need to and want to do. And then we can speak the same language finally.
Sure. Linda has a couple of automations, and Linda, do you want to expound on those at all?
Yeah, so in our clinic, we use a few, just focusing on automation part, some automatic reminders for cancer screening to call patients back. There are some benefits too, and even for the A1C example, when I task the MOAs, they use electronic reminders to ask the patients to complete their hemoglobin A1C if they are diabetic. And then afterwards, they were called back for an appointment so we can manage their diabetes. So the benefits of that is that we use less manpower because I feel that our MOAs and our providers are so strained on time because we have to provide direct care time and not just work on these QI projects at the backside as well. But some of the, I think, barriers to or to completing this as well is that some patients, they may not prefer electronic reminders. They really value that human interaction as well. So I think considering patient preference is really important in this. Thanks.
Okay, thanks, Linda.
So I wish that our prevention module would be, and this is again probably a future Oscar Lounge the topic, was more automated, and it truly is a manual input area. In the future, it may become less so if we ever get that integration, the S5 happening with Panorama, which has all our immunization vaccine data to a greater or lesser degree. But that's not anything we have control over. The higher ups need to agree. But what you're just describing is what had to be created outside of Oscar because it currently doesn't exist. It exists in my system to some degree to make life easier because if it's easy to do, we'll do it through Grease Monkey scripts. The automation works like this. A fit test comes in, is flagged as a fit because the script Grease Monkey recognizes it. It creates a entry into preventions, adding the value, the date,
Nice.
and it will set up, maybe not for so much for a fit, but for a HPV swab, a tickler, automatically preset for 5 years, sent to the MOA to recall.
Nice.
Within a couple of clicks, there's really nothing to type. It labels it, it adds the date, it does all of that within the macro because it's 90% going to be the same old. Now, can Oscar as a program do that? And the answer is yes, but it depends on the other contributors to this whole process that they stay consistent and have a standard. And I don't trust them to be consistent and have a standard.
Okay, does anybody have any other questions that haven't been answered? I don't recall if John, if you mentioned this, that you had reviewed the questions that folks submitted when they registered. Some of those I don't think can be answered in this section.
Some of them very complicated indeed. There should be a version of edit measurements that allows you to map measurements. It is extremely confusing, and I will defer always to the vendor to do that because I don't have enough time or knowledge to do so. So that is like if you find a new item, maybe it's fecal calprotectin, for IBD, and you want to track that. Is there a way of tracking it? And there definitely is, but it's a new test and it'll be a new measurement. I would ask the vendor to map that. Can you accept data? This is really interesting. It's technical because if you have a blood pressure device, you have to look at the value and manually enter it. Can you have it enter automatically? And there are devices that can link up to your EMR that will automatically add that. There are scales that do that. There definitely are blood pressure cuffs to do that. They're very expensive. They require an API. This is a fancy way of saying they need to be able to communicate. So we don't do that just because, we don't have such a device, and I don't know if they have something that would, interact properly with Oscar, at least not yet. But hey, it's worth asking. But I can't do it. Maybe, the likes of Well or Open and etc. They can do it.
Okay.
Other questions? Are there certain um, So yes, if you have a niche practice, there's a large population of unique conditions that you're following. Yes, there may already be existing measurements for you to track the items you want, such as, hepatitis B serology, antibody levels to see if they're vaccinated, the core antibodies, and so on and so forth. I think most of those are already there. Do they map with the lab values? They may not. That's where you might have to ask your vendor to create those links.
Okay.
And maybe I've stirred the pot and created more questions than I've answered. Please post them, send them to Oscar BC. They can and will be addressed if possible at a future meeting. It helps me learn what's important to you, and hopefully, we do better.
Okay. So if there aren't any other questions or input from folks, I have launched a survey. Hope everybody can see that. It's just a really quick evaluation of today's session. Would love to kind of get a sense of how this went for you today. So please do join in our poll and we'll share the results with you. Yeah, and I guess at this time, maybe I'll just do a quick reminder. Please do look for registration for our upcoming AGM and luncheon event. We're very excited. It took us 3 years. We finally convinced Dr. Ross, Kathleen Ross, to be our keynote speaker. We're really looking forward to that, and I hope you are too. So we will be posting more information about that, but look for the registration on Eventbrite or through our website and our newsletters. Is there anything else you'd like to add here, John or Linda?
I just want to thank the audience. I know it's a small audience. This is the first time, first attempt. I think there's going to be many more. I appreciate your patience as we worked out some of the technical glitches. I really did want this to be bi-directional and interactive. Please send feedback, good, bad, or otherwise, and we will, as I hinted at, do better.
Okay. All right. So I'm just gonna leave the poll here for another 30 seconds or so. Please jump on that if you can, or if you haven't. And that's it. I want to thank Dr. Yap today for sharing his time and his wisdom and his expertise with us again. It's likely we'll do some follow-up on this, either with another session, more advanced session on measurements. We'll chat about that. I want to thank Linda for her contributions and participation with us. And yes, of course, we absolutely thank all of you who joined us today, and for your input and your questions. So I will end the poll really quickly and we'll see where we were. And can everybody see the results?
Yep.
Yep. Okay. So thank you for that. That'll give us some food for thought as well and moving forward. Again, our next session will be June 27th with eForms. So it will be how to tweak or modify and work with existing eForms, very hands-on and again, interactive with John Wilson coming up on June 27th. So that's a reminder as well. That's it from me. If Dr. Yap, if you're good to go, we can
That's
end our
it for
day.
me too. Thanks,
Yeah.
everyone. Enjoy
And
the weekend.
yeah, enjoy your weekend, everybody, and thank you for joining us today.